You say the virus will be around forever, but you can't keep hopping in and out of these lockdowns. How does a curfew, for example, on pubs help?
Well, the idea of that is to reduce the amount of people who are mixing, reduce socialisation, reduce the number of different groups who will meet each other. It's not the only restriction we have, of course. There's capacity limits in hospitality. We're extending the vaccine pass to more settings and asking household close contacts to stay at home. But it is a difficult situation. Things were going so well. I think as a nation we're a little bit crestfallen, a little bit heartbroken that we're back into a difficult space when it comes to COVID. We do have among the highest vaccination rates in the world. Around 94% of adults are fully vaccinated. Unfortunately, the 5% that are not are causing a lot of the trouble. About 5% are not fully vaccinated, but about 50% of people in hospital and ICU are not fully vaccinated. So even that 5% can create a lot of difficulty. And then also, it's very evident now that immunity from the vaccines is waning, and we can see that happening across Europe. And that's why we're going to need to give people a third dose, and that's what we're pushing ahead with now at present.
So you are looking at boosters at this point?
Oh well, more than that, we're providing what I'm now calling the third dose, because I think this is going to be a 3-dose vaccine. Some vaccines require 3 doses. 2 isn't going to be enough, so we're extending that now to more than half the adult population, anyone over 50 and then anyone under 50 with medical conditions. And I'd anticipate that we'll offer the third dose to everyone, as has been the case in other countries.
Listen, do you envisage more restrictions before Christmas? Because that, of course, could be extremely damaging, given people are wanting to come home, travel to Ireland, particularly from the States, for example.
Well, I hope not. We're going to reassess the situation in about 2 weeks' time. And see if cases have stabilised, and hopefully they'll be falling by then, but there's no guarantee that's going to be the case.